The definition of infant CPR is from age birth to 1 year old. Now, if we're delivering CPR to an infant, it's going to be a lot different to dealing with an older child or with an adult. Here we're doing something very, very precious, very, very small. So it's going to be a very tough thing for you to do. But the idea of training and learning about infant CPR is that if you ever were in a situation where you had to deliver CPR to an infant, your training is in your brain, you've been programmed, and you'd hopefully be able to deliver that. So first of all, we're dealing with sort of the initial scene safety and the permission. Now, with the infant, obviously they can't ask you back, but still communicate with them. You can still ask them and talk to the baby, because what we're trying to do is get a response from them. So they're not going to be talking back, obviously. They're going to give you other signs. Maybe you might see twitches, you might see movement. So when we're assessing for response, then we can get those sort of responses back. As far as permission goes, if the parent or guardian is there, then you can ask the question, I'm a first aider, may I help your baby? And they can give you the consent to actually help. Then it gives you consent direct. If you're looking after someone's child and there is no parent or guardian there, you would have what's called implied consent, because I'm sure if that parent knew what was happening, they would want you to deliver CPR. So the first thing we need to do is obviously make sure the scene is safe. Now, when we're doing CPR, on this example here in a training environment, we're doing it on a tabletop. Now that would work fine, it's on a solid, firm surface, but we could also do it on the floor, we can do it in your arm to a certain extent, because of the weight of the baby, we're a little bit less efficient. But if we needed to then move the baby to the ambulance, we could carry on doing CPR while moving them to the ambulance to save more time. So we're now going to look at the process of delivering CPR to an infant. So the first thing is we've asked the parent, or we've given a little tap, and also tap on the feet. That's a very good way of trying to get a response. Trying to ask them if they're okay, and just maybe you can get a response. In this example, we have no response. So we need to try and find out whether they're breathing. When you open the airway on a baby, it's a little bit different from that of an older child or an adult, because the airway itself is not fully developed yet. So if you were to open the airway fully and tilt the head right back, like you would on an adult CPR, what actually is going to happen, you will open the airway, but then you're going to close it again. It's like a garden hose. If you take a garden hose, the water's flowing, and then you just bend that hose slowly, eventually it's going to crease. And at that point, no water's going to come out. And the airway on an infant is very, very similar. So what we do is we need to just move the head back into what's called a neutral position. Not overextend it, because that's going to stop the airway. Not leave it down, because that won't be open. So it's just keeping that in nice level form. So with the mannequins like this, if you open them too far, you'll find that you can't get the air in there anyway. So the mannequins are also designed to allow the air to go just in when the airway's open correctly. So we need to find out if they're breathing. So it's head tilt, chin lift. So fingers on the top of the forehead, under the bony part of the chin. Tilt the head back into that neutral position. You pop your ear down there and you're doing a breathing check for 10 seconds. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We counted to 10, we now know the infant is not breathing. Now, if you came across this situation, the first thing you're going to do is shout for help, but let's just assume in this example here, we're on our own. So what the idea here is a little bit different from with adult CPR, is we would do 1 minute of CPR first and then go for help. The reason for this is we're dealing with a respiratory problem here, normally with infants and children. So hopefully by delivering CPR for that 1 minute period, the infant will come round. So we don't really want to waste too much time calling the ambulance at that point, but we must then, after that minute, call the emergency services. And if somebody else was there, obviously send them to call the emergency services, tell them exactly what you're dealing with. You've got a non-breathing infant and you're delivering CPR. That'll put the call at the absolute maximum priority, and hopefully your help will be there within 4 to 8 minutes. So once we've established that they're not actually breathing, then we need to deliver breaths. Now, with breaths, you can use face shields, you can use pocket masks and things like this, or you can go straight down onto the mouth. Now, we're going to demonstrate going straight down onto the mouth to show you how that happens. But if you're using a pocket mask, then you can pop the mask over. Normally, you would put a mask on this way round, but with infants, these masks are designed to fit the other way round. So if you pop that over, and it's going right over the face. So therefore, you've got a good seal around the whole of the mouth and the nose, and you can put the breaths in there, and you can keep a good barrier between yourself and the infant. Now the key thing with doing the breaths is we're putting the breaths in and we will seal our mouth around the mouth and the nose, not just the mouth. Now with older children and adults, yes, you can squeeze the nose quite easily, but with an infant you won't be able to do that. So to start with, just tilt the head back into that neutral position. We're sealing around, and the actual area is right around the mouth and the nose so that we get a good seal. And then you're putting the breath in. Now you're not doing the breath the same as you would with an older child because the lung size is much smaller. So it's just a gentle puff until you see the chest rise. And we're delivering 5 breaths. So we're delivering breath, 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 and breath. And when you put the air in, allow the air to come out and then put the next breath in. So that way we can flush the baby, their respiratory system with as much oxygen as possible. So we're just going to run through that side and then we'll show you how to do the chest compressions. So each time I'm doing the breaths, I'm just checking, looking down, as in the corner of my eye, I can see the chest rising and falling. So I know the breath's going in. Also, I'll be able to feel the breath coming out on my cheek. So you know that air has gone in. So once you've done the 5 breaths, we then move down to chest compressions. Now we do this a little bit different. We're just using 2 fingers. So you can use 2 fingers on either hand, and we're pushing it just in the center of the breastbone, exactly in the same place as we would with adults. But with the infants, you can look at it at the line between the nipples on the infant. So we're just literally popping the fingers on, and we're pushing down about 1/3 of the depth of the chest. Now pushing down 1/3 of the depth of the chest is quite a severe depth to push down, but we need to do this to compress the heart. And again, same with older children, is we need to ensure that that chest has been risen back up. So we must make sure the heart is refilled with blood. So doing the breaths, we're doing 30 compressions and we're doing them at the same speed, 100 to 120 compressions per minute. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Once we've delivered the 30 compressions, we then do 2 breaths. So it would be 2 breaths, 30 compressions, 2 breaths, 30 compressions, 2 breaths, 30 compressions. And what we're doing that just for 1 minute. So we're just running that through, and then if we're on our own or help hasn't obviously arrived, then we must make that call. So put the airway into neutral position, deliver 2 breaths. So once we've gone through the cycle of 32, 32, and we've then activated emergency services, then we will continue the CPR process until the emergency services arrive and they tell you to stop or they tell you to hand over. So once they get here, they will want you to carry on. Now, if it happened inside and you heard the ambulance outside, then you can carry the baby out to the ambulance, that's possible as well, or you can wait for the emergency services to come in. If you are carrying them outside, you need to then carefully pick up the infant, and you can rest it on your arm and still be able to deliver the CPR compressions and the breaths successfully while walking to the ambulance. But that's something you need to decide on the time which is best for you in that instance. So to summarise, infant CPR is a very, very sensitive, it's a very, very worrying thing to do, even in a simulation environment in the classroom. It's quite upsetting in what you're doing, but it's good skill to learn, and the information that you've got there is being programmed into your head that hopefully you won't ever have to do this, but if you ever did, the information is there for easy recall.